Okay, everyone, welcome to an episode here at Doctors of Podiatry. We have this young gentleman who were actually performing adipose-derived stem cell therapy. This young gentleman, his main problem is actually the Achilles tendon of the right. He has a lot of what we call chronic tendinopathy in the area of the watershed zone, which is actually the weakest area of the tendon. This area, okay, which is about 6 centimeters above of where the Achilles tendon inserts, has very, very little blood supply. And the problem here is that not only is he very young, but what we're trying to do is, restart the entire healing process. He's extremely active, plays softball, plays exercises, sports, and it really is affecting his daily life activities. So what I recommended that we do is we perform a percutaneous microtenotomy and then perform the adipose-derived stem cell injection from the fat that we have harvested already with the expertise of Dr. Gabe Salou. And then we're going to go ahead now and mix the fat with the PRP and inject it into the area that is affected, in this case the Achilles tendon. The good news is that he does not have a tear, so that's a great thing. Now, in respect to the left, okay, the patient had a previous injury. I don't know if everyone can see here, but he's got a scar here, and he had previous ligament surgery. When was that? 2 years ago. And he apparently developed a lot of scar tissue, and I suspect that, he's had some residual discomfort after the surgery. So what we're going to also go ahead and do is, perform a microtenotomy in that area as well, and to stimulate the entire, healing process from a physiological standpoint, and also do the exact same thing, infiltrate the area a little bit with some, the combination of the adipose derived stem cell injection with the PRP. This is a great procedure for a lot of reasons. When you talk about the Rolls Royce of the regenerative procedures, injections, this is exactly it.
Okay, you're just going to feel a little manual pressure like this, okay? If it's uncomfortable, you just close your eyes and just try to relax, okay?
That hurts.
Okay. I can give you a little more to stay away from that area.
Stay away from the front. Oh. That, and then you start it out.
So liposuctions with a much stronger pressure than this, I'm doing this me doing this by hand is very, very atraumatic, so that these cells that we have here should have much more chance of being viable than if you do it with liposuction, which is at a much higher pressure. It's much more likely, but you're not saving those cells to the same degree. So if I'm putting it in someone's face, or for this purpose, I do it by hand. No, but we got a good bit of it.
What's disgusting?
It's just yellow. Nice fat.
Beautiful. That should be gorgeous.
You've got lovely fat.
It really is pretty. Shalom, what do we see under here that is that all oil?
Yeah, that's basically just.
Thank you.
That's just oil. Layers that we're not keeping. Could be some lidocaine as well, some of the fluid saline.
Okay, everyone, so here we go. If you feel any discomfort, please let me know. Any discomfort?
How did you feel like this? It's fine. You just like puncturing it?
Yep.
Taking it out?
Just fenestrating the area. Super. Okay, so now let's roll over to your right. Like a rotisserie. There you go. Perfect. Perfect. Here we go. Discomfort?
There was a little discomfort.
Tolerable?
Tolerable.
Okay, we're almost done. Discomfort?
I got it.
You feel that celery? That's the ligament. I can definitely feel, just like he was telling me before, a lot of scar tissue all in this area. A lot of scar tissue. We'll go ahead and give a couple more here. All this right here.
Yeah.
Oof, a lot.
That part hurts. The lower part.
Okay, super. So now we're just gonna go ahead and wait for the next part of the procedure, the cocktail. We already made a little port, right? So we're just trying to. Okay, we're right here. I can already feel here, so it's very slowly. We're gonna start infiltrating. You may feel a little bit of pressure. And everyone can see we're just infiltrating a little bit of the fat there. Really nice. Expertise of Dr. Gabriel Saloom.
Hold on 1 second, Adam. Hold on 1 second.
So we're continuing to infiltrate. You okay there up there, bud?
Perfect. That's really good. We'll leave that just like that.
Need one?
I think we're good there. So we basically like to massage it in, right, a little bit. I think that's good.
What about
Okay, everyone, so we're essentially done. We've infiltrated the adipose derived stem cells as well as the PRP, and not only to the Achilles tendon of the right lower extremity, but also on the region of the anterior talofibular ligament as well as the sinus tarsi area. Again, this is not a first-line treatment. This is an alternative. Once we've exhausted all other conservative measures, this is exactly when we start talking about regenerative procedures. We use this not only for Achilles tendonitis, Achilles tendinopathies, any problems with ankles, ankle sprains, plantar fasciitis, fractures, you name it. The sky's the limit when it comes to using this, again, as an alternative. Like always, I'd like to take this opportunity to thank the entire team here, especially Dr. Gabriel Saloom, plastic surgeon down in Mount Sinai in Miami Beach. Like always, I'll plug him in after. I'll give everyone his information, okay? So stand by, please.